Good morning, Lake Providence Church family and friends. Great to see you. This is Dr. Linda Plummer with another health ministry update. Now we're moving into a new season, getting ready for the beauty and coolness of fall. And we thank God for keeping us thus far through the madness of 2020. We continue to pray for those who experienced trials this year, especially due to the pandemic. Now we have a good handle on how to protect ourselves and each other. We need to keep practicing all the habits emphasized in the last few months to slow the spread of COVID-19. These habits also slow the spread of the flu and other viruses. And like them or not, this new way of life will define our idea of safety and dictate how we interact with each other and how we establish and maintain relationships indefinitely. Seasonal flu caused by multiple influenza viruses peaks in the United States from December to February. The flu vaccine is revised each year to promote immunity toward the influenza viruses that they feel will be most prevalent that year. In addition, there are many other respiratory viruses that cause the same symptoms. COVID-19 is proven to be in a class of its own, causing a multitude of symptoms or no symptoms at all. While we continue to learn about COVID-19, there are still many questions to answer. We continue to follow the science to protect ourselves, search for a cure, develop a vaccine, and just to survive if our bodies get infected with it. We know that those at highest risk for COVID-19 are those over 65, those who have comorbidities, and so on. We also know that those most likely to be vectors or spreaders are older children, college-age young people, and young adults. While these age groups maintain the highest number of cases, new cases, adults age 65 and older are the ones most likely to succumb to it. In contrast, influenza causes most severe illness in infants and toddlers, adults 65 and older, pregnant women, and women up to 2 weeks after the end of a pregnancy. Also, people with chronic illnesses like sickle cell, those with a weakened immune system, and those who are morbidly obese. Because of prior exposures and vaccinations from previous years, there is some immunity to the flu already. Flu shots are recommended, especially this year when both COVID-19 and influenza will be circulating. COVID-19 and the flu are spread primarily through respiratory droplets. COVID-19 has been shown to also be airborne. Touching contaminated surfaces is not as important in transmission as respiratory droplets, although it is still a mode of transmission. The onset of symptoms after exposure to influenza is about 2 to 3 days, as opposed to COVID-19, which is about 2 to 14 days. Influenza usually lasts about a week, whereas COVID-19 can last 2 weeks. Either infection can last longer or cause long-term symptoms. Now, the gold standard for COVID-19 diagnosis is the 24 to 48 hour PCR test. That requires a swab through the nose toward the throat, or as some prefer to say, through the nose and to the brain. Now, both COVID-19 and flu can be diagnosed with a 15 to 30 minute less invasive rapid test. And in some cases, it's cheaper than the PCR test. The other thing we need to remember about that is that the rapid test may not be as accurate. And sometimes if someone has persistent symptoms, the PCR test is needed to be done in order to prove the negative rapid test. There are medicines for the flu that don't cure the flu, but decrease the severity of illness and the number of days that it may last. Most people recover from both COVID-19 and flu with symptomatic treatment at home. Both illnesses, separately or at the same time, can cause severe illness and death. Both infections require isolation or quarantine when one is sick or exposed. It is well known that quarantine fatigue is real. In your preparation for the holidays, there's no need to be fearful, but consider the spectrum of risk and the habits to help slow the spread of disease. We don't want to have to quarantine or isolate ourselves. Prevention is the key. Now, all exposures don't carry the same risk. It's believed that the larger the dose of virus we get, the sicker we will be. And that's whether we have chronic illnesses, we're over age 65 or whatever. Don't have to be any of those. The larger the dose of virus we get, the sicker it will make us. There's a chart by Julia Marcus from Harvard and Eleanor Murray from Boston University. It shows their spectrum of risk, as they call it, for COVID-19. Basically, in a nutshell, remember, staying safe at home with members of your household is safest and carries the least risk. Outdoor activities such as walking or biking with others are the next best activities. Group gatherings outside are medium risk. Outdoor gatherings for Nashville and Davidson County should be 25 persons or less. Indoor gatherings carry the highest risk. To reduce the risk at any level, remember these tips: mask, distance, clean hands, fewer people, ventilation, stay at home if sick, shorter interactions, avoid sharing food, drinks, toys, and sports equipment. And what does stay at home if sick really mean? It means if you have any symptoms, great or small, if you feel like you've been exposed, stay yourself at home. That's what it means. Don't risk the health of your family and friends, especially those who are most vulnerable. We pray that this has been food for thought for your good health. Thank you for joining us today. Oh, and by the way, we also invite you to our October 4th Saturday mini-series on October 24th, Facebook Live at 10 a.m. This month it'll be with our own Dr. Robin Williams and other panel members for an up-to-date discussion on breast cancer. Follow us on Facebook and YouTube at LPMBC Nashville Health or LPMBC Nashville. You can also find us at lpmbc.org and the church app. There you'll find previous episodes on mental health, Alzheimer's, and colorectal cancer. We lost a member of our health ministry in the last week. He was not a member of our church. His name was Randy Bausch. We ask that you keep his family in prayer. As always, be safe, be healthy, and stay prayed up. God bless you.